Good morning.
Good morning, Sean. My name is Marcos. I was asked to follow up with you about your recent hospital visit last night. Hopefully, if you have some time, can we talk for a few minutes?
Sure, I knew that somebody was going to contact me, and so I've been waiting around to join this session here. So, sure.
How are you doing this morning, Sean?
Oh, I'm cranky. My back hurts. I thought they were going to give me some pain meds. I didn't get anything, so I feel like I'm aching all over, and my back is kind of bad.
So, a little more about me. I work here at the hospital, and our departments are working together to follow up with people who had experiences like you had yesterday at the ER. So I'm part of the team, and my goal is to see if we can actually help you in any way so this doesn't happen again. Um,
Okay.
yeah. So, can you tell me what happened? What happened with your hospital?
Well, I have this really I had a back bike injury. I got a really bad back pain, so I went to the doctors to get I thought they would give me some pain medication last night, and instead they took a urine sample, then they started talking to me about substance use and kind of made it sound like I had a substance use problem, and all that kind of led to they thought I should talk with somebody like you. So, didn't turn out like I thought it was going to turn out. So, here I am.
I hear you. I hear you. So again, I appreciate you taking the time to for this meeting. All right. And, if it is okay with you, can we spend a few minutes talking about your substance use?
Well, I figured that's what you wanted to do. So, yeah.
So tell me about your substance use, Sean. In a typical week, what does it? What does your substance use look like?
Well, my doctor prescribes meds, but those run out in about 2 days. And so I've been buying some meds on the streets. And when I can't find those, I buy some powders. And I've been doing that for some months now. And that's kind of what it looks like.
If okay with you, can I share it and with you and tell you about the hospital's discharge report?
Sure.
So the report mentioned that you were very agitated, and as you had just mentioned this, all right, you talked about being in severe pain as well, and you had a substantial amount of opioids in your blood test. Medical staff were concerned that you had other complications related to substance use and were trying to get opioid drugs to help. What do you make of all that?
Well, it's kind of true. I mean, I wanted them to give me some drugs. I didn't think we'd end up talking about having a substance use problem. So I was surprised by that. I guess I could say it didn't turn out the way I thought it was going to turn out.
So again, I get a little hint here. The pain plays a role. So can I share more information with you, Sean?
Sure, sure.
Do you know that had a physician prescribe you more opioids, you would have been at risk of an overdose?
No way. Really?
That is correct. Also, do you know your personal doctor will have access to your ER discharge report and may have some concerns as well?
Oh, that's not going to be good either. That means he's going to probably try to cut me off.
And I understand that you are in a tough spot, but what do you think are a few benefits you might get if you do decide to change your opioid use?
I I never thought about that, but I mean, I I guess I don't. I keep worried about getting arrested. When you're buying dope on the streets, you're always worried about getting arrested. So I surely don't want to end up getting arrested. And they're always talking about overdosing, and so when you buy that stuff on the street, you never know what you're going to get. And I've come close a few times, but so far I've been in luck.
So, Sean, let me ask you on a scale of 1 to 10, with number one being not ready, number 10, very ready. How ready are you to make a change in your substance use or a change in your life?
I don't know, like a 4 or 5.
Hmm. Why do you rate yourself a 4 or 5 and not a 2?
Well, I mean, things are getting worse. I mean, I'm buying more dope. I went to the ER. I've never done that before. I've come close to overdosing a few times. Um, I don't know. It feels like I'm on a downward spiral, so things are kind of getting a little bit out of control.
I understand. So, what concerns you most about your recent hospital?
Well, that you're gonna tell my doctor, that's gonna be bad. And I don't know. It's just like it feels like I'm starting to run out of options about what I'm gonna do. I mean, it's getting dope is becoming harder and harder, and I'm just like I said, I'm just kind of running out of options.
So let me see if I got this right. Do not make some changes. Your drug use is going to get worse. You worried you might overdose and make you think you will never get your job back. However, if you do make some changes, you can actually break this cycle you're in. You will avoid legal trouble and you might get your life back. What might be the next step for you, Sean?
I don't, I didn't even think I was going to be taking any next steps. I mean, what, what can I do?
Oh, um, good question, right? How can we help you? Is the question, right? How can we help you?
I, I, I don't know. I mean, I'm, do you have a recommendation or something?
Sean, what do you think about talking with another professional who knows how to better manage type of situations? I have a connection with a local clinic, and I can get a person on the phone right now to meet with you and talk about potential next steps. Will you be willing to do that?
Like right now? Like right now?
Moment, at this moment, all I have to do is get on the phone, call the clinic that I'm telling you about, connect with the one professional, and let you guys take it from there.
But I'm not committed to anything, right? I don't have to
Uh,
do anything.
as I mentioned, potential next step. That
Okay.
that that from there, I will have no control. But then again, I can assist you, be of assistance to get you connected with this professional, and you guys take it from there. Will you be willing to do that?
Yeah, as long as I'm not committed to anything, I'll talk to the other person.
Yeah, no problem. So now let me just while I'm doing that, may I call you again in a few days to see how are you doing?
Yeah, that'd be all right. I mean, you
Okay. Just hang in there, Sean. Let me get on the phone. I'm gonna put you on hold and I mean get you guys connected so that way you guys take it from there.
all right, thank you.